Now, I want to talk just for a second about vitamin D in neuropathy care. Okay? And this is one thing that we talked at the Primo was pretty cool, and the new ways that we have to help this. But vitamin D is the sunshine vitamin, right? Where is it produced? Oh yeah, it's produced in the skin by sunlight. What happens if you have loss of intraepidermal nerve fiber densities in your skin because you have diabetes, or you're obese, or you're pre-diabetic, or you have neuropathic pain? What do you think is going to happen to your ability to produce vitamin D? Oh yeah, makes perfectly simple sense now. You're not going to be able to produce enough vitamin D. We're already deficient in vitamin D anyway because we don't live outside anymore. We live in houses. We live in cars, and we wear clothes. So as a society, as a culture, we have less vitamin D. If our nerves are affected, guess what happens? Down the drain we go. Do you think that light therapy will help people produce vitamin D? Very interesting. So let's take a look at this seminar. Again, we talk about the skin. It's a metabolic powerhouse. It's an organ. It has functions that people don't pay attention to. Okay? Again, some nice pictures of all the stuff that the skin does and the cutaneous nerves. Here's some from our patients. See the pretty nerves? Pretty pretty. Okay? Pretty pretty. How about this guy? Not too pretty. Not too many nerves there. What do you think if you look at the ramifications of this? Okay? As far as fighting infection. All right? Being able to have your sensory tissue, your environment function well, it cannot. Not just sensory, but its motor functions, its defense mechanisms. Okay? So if you look at the current trends and how about now?
Welcome to GoToWebinar, Web Event Easy.
Sound is back now, right? So what we're saying is that, let me just double check these questions here. Okay, good. Okay, so here we go. So the vitamin D levels associated with diabetic neuropathy, and this is from Professor Kachi, whatever. This is available online. This lady did a webinar, and I took a lot of that information from her webinar, and you can go online, and I'll give you the thing. You can watch the whole thing for an hour if you want. Okay? Vitamin D as an analgesic for patients with type 2 diabetes and neuropathic pain. How about that? Okay? So they've even done huge studies. This is from July 2011. Vitamin D insufficiency is associated with self-reported neuropathy symptoms, even after adjusting for all other things. Okay? So association of serum vitamin D levels in diabetic polyneuropathy. According to the American Diabetic Association, there's huge numbers of people that have diabetes. There's 54 million are pre-diabetic. I think that's enough new patients. Peripheral neuropathy is estimated about 8% of patients, and 50% of long patients have this type of neuropathies. Leading cause of foot ulcers and amputation. Okay, this is some different things that you can look at. That the glucose metabolic pathways, injurious alone or collectively, may cause an imbalance in mitochondrial redox state of the cell, leading to excess formation of reactive oxygen species, or what we could say free radicals. Neuropathy may occur from both hyperglycemia-induced damage and neuronal ischemia caused by decreased neurovascular flow. There's your references. They wanted to look at molecular and biomechanical pathophysiology of diabetes focused on glucose pathways, okay? there might be a relationship between serum vitamin D and diabetic polyneuropathy. Does low serum contribute to the development, and does low serum make it worse? Okay? These are the studies that they looked at by changing these different things. Vitamin D is analgesic. Vitamin D potentiates axon regeneration. Okay, this is in the this is in the animal study. Okay, vitamin D increased nerve growth. Okay, nerve growth factor was expressed in these people because vitamin D induces expressions of nerve growth factors in the epidermal cells, and it's been shown to help neuropathic pain in a case report of increasing their, this is a nerve conduction study. So if you give them vitamin D, it alleviates their symptoms. And vitamin D is an analgesic in these patients. How many patients with diabetic neuropathy and vitamin D deficiency? We see many diabetics in neuropathy and vitamin D deficiency in New England where she is. So they did a study which used vitamin D insufficiency is common in the U.S. population. And vitamin D and calcium intake correlates with the development of type 2 diabetes. Okay? And it hurts all different ethnicities. So vitamin D deficiency is common to all groups and predisposes people to the development of diabetes. Some patients with neuropathy could be developing diabetes, but that's backwards. Okay, and the pathogenesis of neuropathy could have started before the diabetes. What they wanted to do is see is there a relationship between vitamin D levels and diabetic neuropathy? And is there a correlation between the concentration of vitamin D and the severity of their neuropathy? Okay, so they used neuropathy, they used nerve conduction studies, the presence of neuropathy, and the symptoms of neuropathy. Man, the sound is really messed up today. Am I doing good? Yeah. Getting some feedback. They looked at all these women that had type 2 diabetes, these people. They took, if anybody had neuropathy from something else, they kicked them out. They looked at all these points, and they looked at if they had patients with low vitamin D were referred to their physician. So they did a very good study. They looked at the Michigan Neuropathy Scale. If they had a scale of greater than 7, they had neuropathy. And they did a couple of tests on them. And then they did a questionnaire very similar to ours. They looked at the questionnaire, okay? They looked at the diabetic score from their little clinical exam, and then they started the thing. They looked at 5 nerve conduction studies, okay? And they looked at the number of nerves that were abnormal, and then they gave them the total thing, and then they correlated that with their vitamin D. So they looked at how bad the neuropathy was, and they correlated it with their vitamin D. So look at this. Patients had lower vitamin D than controls. Okay, so anything under 20, okay, 40 is about normal is what you want to shoot for. Okay? And if you looked at it, if you looked at the vitamin D levels of diabetic patients without neuropathy, they were all pretty good, all pretty high. You see that? And if you looked at serum vitamin D levels with patients with neuropathy, look at that. So their scores went down, you know, the more vitamin D they had. So based on the preliminary data, we see a correlation between serum vitamin D levels and neuropathic symptoms. So you can have neuropathy and not have symptoms, right? And that means your vitamin D level is high. Well, the control group was about 40. and the neuropathic pain group was around 20. Regarding the correlation of severity of the neuropathic symptoms and vitamin D level, more symptoms had lower vitamin D level and more nerve damage. There's association between vitamin D levels and diabetic neuropathy. There's association between the severity of the neuropathy pain and the level of vitamin D. So we don't really care, but what we care about is this right here. Giving patients their vitamin D3 in the most effective way possible. Okay? This is a oral spray vitamin. It's cutting edge. It's what we give our patients to make sure they don't have to take another pill. They squirt it in their mouth. They carry it with them, and they can spray it 4 times in the morning and 4 times at night, and they get 8 sprays a day. That's the whole deal. Okay? Absorption is not a problem. They don't have to take any more pills, and there's a correlation between the level of vitamin D and their pain. Look at this. $10, $11 each, and you sell them for around 29 or 30. This is a good deal, and this is also available right now on the e-store, and as soon as we get this webinar up, it'll be correlated, and you'll have it in there like that. And this is the website that you can go to watch this actual professor, Lila, give this talk. It's pretty cool. If you're interested in all the details, I cut out a lot of it, and she's kind of hard to understand, but there is the website where you can go and watch this video. I hope I didn't go through that too quick. The audio sounds like it's working now. So what do you think about vitamin D spray? Huh? Comments? Questions? Picard, are you there? Can you hear me? There he is.
Here, Joe.
What'd you think of that?
Yeah, what's the, you mentioned the dosage, I think you said like 4-8 sprays.
Welcome to GoToWebinar.
Yeah.
Easy.
That's what we use. 8 sprays. It's easily absorbable, and it goes right to their mucosa, and I think that gives you about 5,000 IUs of your vitamin D3. Tim doesn't have a microphone. Dr. Bragg.
Yes.
What'd you think of that? That's a pretty good correlation. Now I got the science behind those sprays, huh?
Yeah, I like it. I know you guys surely have done your blood work and you tested your product there to be able to drive your vitamin D levels up.
Yeah, that's what Dr. Spray has been doing. And, you know, I think is giving them an oral solution is much better than, even though it's a small pill, these patients have gut problems, the inflammatory people, I don't think they're going to be able to assimilate that stuff.
Mm-hmm.
Just gives us another option, you know.
Sure.
And they say I'm taking vitamin D, and they're taking like 100 IUs. And if they have neuropathy and if they have pain, it's not enough, you know. So I just wanted to share that with you. That was great having you at the Primo too. You're doing good. Let's see if Happy Horse says something. Go ahead, Dr. Happy Horse. Oh, no microphone today. How do you know when the vitamin D level is up to normal? Well, one way might be to think if they use it daily. Yes, every day. If their pain goes away, their vitamin D levels are probably coming up, and then you can just recheck their vitamin D levels later. But they're never going to be able to get off this thing, probably. So it's a good thing to have them come back every month to get another packet. Get another spray. Dr. Wilson. He's just hanging out. Anybody want to make a comment? Raise their hand. Maddie D.
Hey, what's going on?
Did you see how we put the background to that stuff about the spray vitamins?
Yeah, I like that. We we got a packet of the B12 spray and also the D3 at the Primo, and I've been using it ever since, and my staff, and we like it. It's a good thing. I haven't started my patients on it, but I'm gonna start putting that right in, their first month's worth right in the protocol.
Yeah, I think it's so simple, easy to use.
Not another pill they have to take,
And not one more pill. They get ticked off if they have to take another pill.
The stuff actually tastes pretty good too. The B12 I think is a little minty, and the D3 is a little fruity.
Fruity.
It's good. It's not offensive.
And I think it's a great thing. If you look at it, they say vitamin C for colds, but it's actually vitamin D that helps you with your cold and flu season. So I want to say that I think we covered a lot of areas, but it kind of correlated. We came up with a new treatment tool and a new diagnostic tool today, and I think you understand the reason why we use this, because they're effective in the patients that we take care of. Okay? So if there's no other comments or questions, we'll got one more question here. Let's see what we got going on. No, I would say the question is how about reducing the vitamins until after the first re-exam? And I don't really, is it part of our treatment protocol? I think it should be. I think the nutritional part is just as, if not, everything is important, The DME is important, the biopsy is important, the nutrition is important, and the light care is important. And the bottom line is we're not trying to prove that light therapy helps the patients. We're trying to get the patients better with our treatment protocols, in my opinion. So people who say, well, they're going to wait and give them their B vitamins afterwards or everything like that, let's try to get them better as quick as possible. Let's try to up our results. Oh yeah, let's put that webinar back up. Let's put that back up. There is the site to go watch this webinar if you want. Okay, and you don't have to log in or anything. It's how long is it? It's about 49 minutes. But I thought it was, it's kind of technical, and she doesn't, and we're the first ones to really describe neuropathy means your skin doesn't have can't produce. It doesn't have the metabolites, it doesn't have the products, it doesn't have the vasculature. I mean, it's not going to work. So it just makes perfect sense for the skin and the vitamin D in the neuropathy patients. I mean, it's just mega, mega important. So I thank everybody for being here. I'll see you on the web. Go online. Get with Scott if you're having trouble getting online and making your purchases. Or you could just call Jim and he'll, send you the stuff. I'll put I will email everybody the order forms sometime today. I'll just set them onto the Google group. Okay. So I thank everybody for being here, and I'll see you on the web. And we have the next Primo is going to be in February, so you should be getting some emails on that. Thanks a bunch.